All right, let's jump right in. Today, we're going to talk about a really complex and honestly fascinating condition where the body basically turns on itself. We're diving deep into something called Behçet's disease. But before we get into the nitty-gritty, I want you to think about this for a second. What if your body's own defense system, the thing that's supposed to protect you from everything, suddenly became the enemy? That right there, that's the core conflict we're dealing with. And that leads us straight to what this is all about. So, Behçet's disease is this rare, chronic inflammatory disorder, and the key thing to get here is that the immune system just gets confused. It starts mistakenly attacking its own blood vessels. That's pretty much the definition of an autoimmune condition. Okay, so that's the perfect setup for our first section, a war within. Let's really dig into what this autoimmune attack looks like. Just imagine your body's security system, right? It's supposed to be super sophisticated. But with Behçet's, that system just goes completely haywire. It's like it can't tell the difference between a bad guy, a virus or bacteria, and your own healthy cells. So what does it do? It starts attacking the very infrastructure it's meant to protect. And in this case, that's your blood vessels. So if there's this war going on inside, what does that actually look like on the outside? That brings us to section 2, a body under attack. And this is where it gets tricky, because the symptoms are all over the place and can be super confusing. It makes it a real puzzle to diagnose. Okay, so where does the investigation start? Almost always, it starts right here. The number one most common clue, we're talking something that affects nearly everyone with this disease, is having these really painful mouth sores. They're a lot like canker sores, and they keep coming back, at least 3 times a year. But this isn't just about the mouth. The attack is systemic, meaning it goes way beyond that. You also see other common signs, like painful genital sores. And get this, they can cause scarring in a staggering 75% of patients. Then there are skin issues, like these red, tender bumps or even sores that look like acne. And on top of that, arthritis, usually in the big joints like your knees and ankles. It's so important to remember that all these different symptoms, they all trace back to that one core problem, inflamed blood vessels, just in different places. Now, we need to talk about what's probably the most serious threat this condition poses, and that's to a person's vision. This is where things can get really, really devastating. So that same inflammation can hit the eye in a condition called uveitis. We're talking painful, red eyes, blurry vision, and here's the crucial part. It can lead to permanent vision loss in about 20% of cases. That's 1 in 5. It's why catching this and treating it early is just absolutely critical. And the assaults doesn't always stop there. In the less common but much more severe cases, this inflammation can turn inward. It can start affecting vital organs. We're talking the brain, the gut, major blood vessels, and yeah, even the heart. This table really paints a picture of the challenge, doesn't it? On one side, you've got the common stuff that most people get, but on the other, you've got these less common but potentially life-threatening complications. You can see why it's so tough for doctors. They're looking at this whole constellation of symptoms that can pop up almost anywhere, anytime. So with all that chaos, how in the world do doctors actually figure it out? How do they solve the puzzle? Well, that's what we're covering in section 3, solving the puzzle. Let's look at how a diagnosis is actually made. Okay, so here's the thing. There's no single blood test or scan that just screams Behçet's. Instead, the diagnosis is more like a checklist. The absolute must-have starting point is those recurring mouth sores. Then a doctor needs to find at least 2 more things from a list of Hallmark signs: genital sores, eye inflammation, those specific skin issues, or something called a positive Pathergy test, which is basically a very specific skin reaction to a simple needle prick. All right, so once the puzzle is solved and there's a diagnosis, the whole game shifts to management. So let's get into section 4, controlling the condition, and see how people actually live with Behçet's. The first thing we have to get straight is that there is no cure. Not yet, anyway. So the entire goal of treatment is about one thing: control. It's about easing the painful symptoms, dialing down that underlying inflammation, and, most importantly, trying to rein in that haywire immune system. And to get that control, doctors have a pretty decent toolkit of medications. We're talking powerful immunosuppressants like corticosteroids to really calm the whole system down during a flare-up. For the really serious stuff, like the eye disease, there are these targeted drugs called anti-TNF therapies that can be a real game changer. Other medicines can help make the attacks happen less often, and of course, there are topical things like special mouthwashes to give some relief from the painful source. Okay, now for what I think is a truly fascinating part of this whole story. We're going to zoom way out for our last section and look at the disease's really interesting nickname, the Silk Road disease. This is where we get into geography and genetics, and it's pretty cool. So, researchers started noticing this remarkable pattern. The disease wasn't just randomly spread out. Nope. It was way, way more common in people whose ancestors lived along the ancient Silk Road. You know, that historic trade route that connected the East and West. We're talking about places like Turkey, Iran, and Japan. And this chart, wow, it just makes the difference so incredibly clear. Look at Turkey. The rate is about 2 people for every 1,000. Now, compare that to the US or Europe, where it's more like 1 in 100,000. That's not just a small difference, it's a massive gap that screams there has to be some kind of genetic link tied to this part of the world. And sure enough, there's a genetic smoking gun. Scientists found a specific gene variant called HLA-B51 that is strongly linked to the disease. And guess what? This gene variant is found way more often in those exact populations along the old Silk Road. It's the perfect link, connecting the map directly to our DNA. You know, this disease has been around for a long, long time. There are descriptions from Hippocrates way back in the 5th century BC that sound an awful lot like Behçets, but it wasn't officially put on the map, so to speak, until 1937 by a Turkish dermatologist named Dr. Hulusi Behçet, hence the name. And those diagnostic rules we just talked about, they're pretty new, only established in 1990. And of course, the research is ongoing every single day. So, that kind of leaves us with one final thought. We've followed this thing from being just a weird collection of symptoms all the way to a defined autoimmune disease with clear ties to geography and genetics. It's been quite a journey. So the big question is, as researchers keep tracing its path from ancient history to modern genetics, what other secrets is this Silk Road disease going to reveal next?